Report says the states with abortion bans have more infant deaths, more births as well. All right, let's get into it. Put it at full mass. So a new study showing that states with abortion bans see more births, but also more infant deaths has surfaced. KFF analysis of state policies and court decisions as of December 20th, 2024. So in the first study, Johns Hopkins researchers found that birth rates rose 1.7% in states with abortion bans. It showed that the bans primarily affect racial minorities, younger individuals, and those with lower income or lower education, especially in the South. Let's put it up. Quote, those experiencing the greatest structural disadvantages and in the states amongst the worst in maternal and child health outcomes experience the greatest impact of these abortion bans on the number of live births. That's according to Suzanne Bale, PhD and MPH, Master of Public Health. The paper's lead author and an assistant professor at Johns Hopkins Bloomberg School of Public Health, she said this to ABC News. Quote, many of these occurred in states with among the weakest social services and worst outcomes, potentially deepening existing disparities and placing additional burdens on already strained resources, she said. So before I continue with the analysis and some of the background, it is very clear that the simple approach of banning abortions, all right, meaning they will proclaim they are pro-life. That's the political ploy. Oh, we're pro-life. But they're pro-death penalty and pro-killing people via war. They're also pro-defunding adoption agencies and maternal care advocacy groups, and the list goes on and on. So I don't see how in the hell they could ever be pro-life. You see what's happening with the numbers. The numbers are quite clear. You have a political party who has said, no abortions, no right to choose for a woman, but that's a political ploy for them to be able to proclaim that they are somehow pro-life. But they are pro-death in so many ways. They are pro-death as it relates to actually caring for the child. They are pro-military engagement, killing people, blowing things up, no problem, plenty of money to do that. They are pro-defunding Meals on Wheels for the elderly and those who have particular disabilities, no problem, no issue. We will take their money away. They also will take away support services to assist with the child and the mother once the child is here. All of those things they are against. But somehow they are pro-life, makes no sense. And now we see the reality of adverse policies, they actually lead to more death. At the same time, infant deaths rose in states with abortion bans. Let me say that first sentence again. At the same time, infant deaths rose in states with abortion bans, according to another Johns Hopkins study, analyzing birth and death records from 2012 to 2023. Bell's team noted 478 more infant deaths than expected in 14 states with the bans. The highest increases were seen in Black infants, about an 11% higher death rate, infants in southern states, and infants born with severe medical conditions. Quote, when you look at Texas' contribution to the overall findings, we see that Texas is responsible for 73% of the additional births and 80% of the excess infant deaths, Bale said. The line that every conservative has used in debate formats on this program and others has been the sanctity of life. Has one conservative talked about the increase of infant deaths due to the adverse policies of these Republican states, not a damn one. And that lets you know their integrity is located in the politics of the argument rather than the substance. Mm-hmm. But states without bans have also felt the effects. Colorado State University. Their researchers found that abortions for out-of-state residents in Colorado rose from 13% in 2020 to 30% in 2023. Abortions among Colorado residents also peaked 6 months after Texas abortion ban, with an 11% increase in first trimester abortions and an 83% increase in second trimester abortions compared to before the ban. The surge in demand led to delays, possibly raising cost, emotional toll, and procedure complexity, the author said. However, second trimester abortions have since stabilized, possibly due to expanded telehealth, self-managed abortions, and access in other states. They added, currently, abortion is illegal in 12 states. According to the Kaiser Family Foundation, and 29 states have some sort of abortion limitation based on the age. 9 states have no restriction on abortion at all, which means they get an influx as well. The policy is bad all the way around. That's the point. It has a domino effect that goes beyond the conservative states that passed the bill. All right, Francesca, thoughts here?
Yeah, I mean, I think we really need to remember that it's not just that it's political. And it's not at all about, being religious or being pro-family or pro-life. It is political, but more than that, it is about cruelty. It is about keeping women and children in line, right? It is about controlling their bodies, and it is about subjecting them and their families to the most heinous of circumstances. Remember that so many people who seek abortions are already parents. They cannot economically afford to have another child, or they want to have another child. They certainly and sincerely do want to have another child, but they want to have a healthy child. When you are not allowed to get access to an abortion and you test for lots of genetic abnormalities, that is going to ensure that your child will not survive maybe its first day, maybe its first hours of life. So what happens? Instead of terminating a pregnancy, which, yes, can be sad, it can also be a saving grace. But instead of terminating that pregnancy, politicians are obligating families to carry that pregnancy to term at potentially the health risk of the mother, but certainly a health risk of the baby that has possibly a genetic abnormality. And then when it is born, that family has to go through watching their newborn child struggle for life, maybe even struggle for breath as it dies in their arms. And that is what they think is pro-life. No. It is the height of cruelty. I say this as someone who has had a child, who's held a newborn infant in my arms, and I tell you, it is so unbelievably cruel to make anyone go through carrying a pregnancy to term that they know will not result in a healthy child. So this is what we've known was going to happen. We see it's going to happen. As you mentioned, they defund WIC. WIC is a program that specifically helps women and infants with nutrition, right? They're defunding WIC. So miss me with all of that. What you want to do is you want more people who are desperate, who are unhealthy, and who die, and use that as a form of control.
And that's exactly what the policy is doing. All right, we'll bring you updates on the numbers as they come.